I have a fibroid. Should I remove it or perform HIFU? What are the advantages and disadvantages of removal of fibroid or myomectomy versus HIFU? Firstly, what are the advantages of myomectomy? Number one, the fibroid is removed from the body. Some patients psychologically feels happier to have the fibroid removed from the uterus. Number two, the fibroid can be sent for analysis and there will be a histopathology report. What are the disadvantages of myomectomy? Number one, there is a risk of bleeding during the surgery. Number two, there is a very small risk of removal of the uterus if there is excessive bleeding. Number three, there are scars in the abdomen. Number four, there is a scar in the uterus. With a scar in the uterus, you will have a higher chance of undergoing a cesarean section when you get pregnant. Number five, there's a risk of adhesions occurring after the surgery, which may lead to difficulty in conceiving in the future. Number six, there is a risk of recurrence. Number seven, the surgery is done under general anesthesia. Number eight, there is a risk of complications such as injury to the pelvic or abdominal organs and risks of anesthesia. Next, what are the advantages of HIFU? Number one, there is no abdominal scar. Number two, the surgery is done under sedation. Number three, there are no scar in the uterus. You can conceive earlier and you can have a normal delivery when you get pregnant. Number four, there is less post-operative pain. Number five, since there are no incision in the abdomen or uterus, you can return to your daily activities in a few days. Number six, there are minimal complications. Number seven, if there is a recurrence, HIFU can be repeated. What are the disadvantages of HIFU? Number one, the fibroid is still in your uterus although it is dead and will take time to shrink. Number two, there is no histopathology. Number three, there is a small risk of incomplete ablation and recurrence of the fibroid. Number four, if fibroid fails, you may need to repeat the HIFU or undergo surgery to remove the fibroid. Number five, there is a small risk of complications such as skin burn, nerve injury, bladder injury, and bowel injury. It is important for you to discuss with your doctor which method is good for you.